Today we have one more topic regarding intestinal infections. That refers to Escherichiosis. Escherichiosis is an intestinal infection caused by bacteria, Escherichia coli, that normally is present in the intestinal tract of humans and mainly in the lower part of large intestine. So the logical question that could appear: how bacteria that normally is present in our intestinal flora and making part of normal flora or non-pathogenic flora is able to produce infections? So if we are talking about intestinal infections specifically, some representatives of normal flora could have ability for mutations for different reasons. Normal flora is very often supposed to treatment either with antibiotics, either with disinfectant substances, just because normal flora is highly resistant in the environment. So when it gets in the environment and when it will meet environmental factors, physical, chemical, mechanical, biological, all of these factors together could influence any resistant bacteria, any representative of bacterial flora, in negative way. But if this affection is not too hard, the bacteria will survive, and generations to come could make some changes in their genetical and morphological and physiological structure or activity. This is what is called mutation. Whenever we are talking about different mutations, we are talking about changings as a result of unfavorable conditions. Mutations never happen in favorable conditions. They all the time happen just in unfavorable conditions. This is why normal flora is more exposed potentially to mutation. As a result, normal flora in any moment can turn into pathogenic flora, because some mutations could just happen without any changes or any consequences for our body. Yes? Well, when we are talking about mutation, we should understand that this mutation doesn't happen by intention. Everything that happens in bacteria, it doesn't happen by intention, like bacteria is sitting and thinking how to change its morphology or its physiology in order to be protected. It is automatic process that sometimes could have as a target protection, and sometimes could just be a coincidence. of different factors. So whenever normal flora passes through mutations, in existing species, or existing species can start being divided in serovariants and different subspecies, or subspecies, or serovariants, or biovariants, in dependence on changings that happened in them. So they stay, they're continuing being part of genus of species, but they produce new serovariants with new features, new morphological and physiological features. As a result, they can stop consuming something, they can stop producing something, or they can start consuming something different, and as a result, start producing different metabolites. And these different metabolites can either become harmless for us, either they can become harmful for us. This is what happens when normal flora will mutate. If we are talking specifically about Escherichia coli, please keep in mind Escherichia coli, however it would look, it sounds like this. What is important to keep in mind about Escherichia coli? Whenever you can find it, it is a kind of indicator. Where could you find Escherichia coli? In which places you can find Escherichia coli? Small intestine? You better not find it there. Large intestine. The lowest, the lower part of large intestine. If Escherichia coli will get in small intestine, probably we will have some issues. Normally, yes, it should be in the large intestine. As a result, normally we can also find Escherichia coli in which places? In bathrooms, in washrooms, right? On the doors. When somebody doesn't wash their hands after bathroom, in public places, in soil, of course, in soil, because when we are talking about soil, please keep in mind, when we are talking about soil, we should be aware about the fact that soil is one of the mostly rich substrates in bacteria. It contains the biggest amount of normal flora in nature, specifically soil. And its function is circulation of substance in nature. The function of soil is circulation of substance in nature. This is why we have a lot of saprophytic bacteria or normal flora in soil. This is the reason why specifically in soil plants are growing, not in sand, not too much in sand, not too much in other substrates, but specifically in soil. Because these bacteria are processing, are decomposing the organic substance and gives the initial material for building of plants, for building. This is why plants are getting their micro and macro elements from soil, because these bacteria are helping organic material to decay and to transform it into micro elements that would be used for generations to come of different kingdoms and species. from kingdoms to species. So, that means also that in soil we will find a lot of representatives of intestinal flora, both humans and animals, right? Because from long time till now, the mostly common place where results of humans and animals' metabolism are getting in is the soil. Yes, of course, in the last period, humans started making different types of infrastructure that can process all the results of humans' metabolism that we call wastewater systems. So not all of them will get in soil, not all of them will get in rivers and in other in our other sources of water. As a result, we prevent spreading of some bacteria, spreading of a lot of pathogens. But you should be aware that soil is one of substrates we can find representatives of intestinal flora, including Escherichia coli. If we're talking about their morphology, not big difference from other representatives we discussed till now, like Shigella and Salmonella. In comparison with Shigella, Salmonella and Escherichia, most of species will be motile, and in dependence on different serovariants, the situation of exoflagella will be different. Either Lophotrichus, as we can see just on one pole, bunch of flagella, either Amphitrichus, either Peritrichus, either Monotrichus. They will be situated and they will be in different amount in dependence on serovariants, biovariants, and so on. But most of them will be motile. And of course they will, very often they will have pili that helps attachment to the surface of the intestinal mucous membrane. It is also very important since the intestinal tract is in ongoing transit of matter. As a result, most of normal flora will need this ability for attachment to the surface in order to stay there longer and in order to keep following generations in the mostly comfortable conditions. As well as you should remember, Escherichia is gram-negative, and most of pathogens that cause intestinal infections, as well as we discussed previously, are gram-negative. Talking about physiology of Escherichia coli. Normally, it helps our digestion. Normally, it is a good representative of our flora. It participates in our digestion. And specifically, it produces vitamin K in our intestinal tract. But when we are talking when different pathogenic strains of Escherichia coli, they are able to produce different toxins, enterotoxins, and what is specific, when they get in the small intestine, in the large intestine, they start produce these toxins. One of the mostly spreaded toxins are Shiga-like toxin, and from its title you can understand that Shiga-like toxin is a toxin that is similar to toxins produced by Shigella. As a result, Escherichiosis caused by some enterohemorrhagic strains of Escherichia coli will have similar symptoms with dysentery, with bacterial dysentery. This is why very often people are used to call any hemorrhagic intestinal infection are used to call dysentery. But specifically, dysentery is infection caused by Shigella dysenteria. And other intestinal infections with hemorrhagic manifestations will be just similar with dysentery by symptoms, and this is why sometimes will be called dysentery, but actually it is not. It is another infection. To not talk too much about specific things regarding intestinal infection, which we already discussed on previous two lectures, I would like to pay more attention to such event as nosocomial infection. And during your entire process of studying, you will hear it for a lot of times. Nosocomial infection. I guess you already heard it, or healthcare associated infection. I guess you already heard about it, and I am pretty sure you will hear about it for a lot of times. So it is an infection that can be acquired during hospitalization. So mainly it will affect patients. But if there is a medical staff that who gets an infection during according medical care, it will be called also nosocomial infection. This is why it is called healthcare associated infection, because whenever any participant of healthcare services is affected during these services, is affected by an infection, it is infection associated with healthcare, with medical care. This is why both medical staff and patients are vulnerable. Who is more vulnerable? Patients or doctors or medical staff? Patients. Why patients are more vulnerable? Of course, absolutely. Whenever you are coming in the hospital with any health issue, your immunity already is lower than in a normal life. There is no big difference which kind of affection you have. Starting with cuts, any form of trauma, any form of maybe fractures, anything, your immunity is decreased, because the immune system is working on general recovery, not just fighting with infections. So immune system is participating in general recovering from any kind of morphological and physiological affection, acute or chronic. This is why any disease or any treatment will suppose that the patient already has decreased immunity. Doctors and all the medical staff also is vulnerable. And which groups of medical staff are mostly vulnerable? those who do have contact with patient, direct contact with patient, first of all, and specifically those who perform invasive procedures. And by invasive procedures, we can understand any procedure that supposes deregulation of integrity of tissues, starting with injections or any form of punctions, and finishing with any kind of surgeries. Any invasive procedure, either treatment, either investigation, any invasive procedure means direct contact with patient's fluids. Every patient, you're never sure 100% if the patient infected with something or not. So any physiological and or pathological materials and or fluids from patient are considered as potentially biological hazard. This is why in any hospital, when you will enter, you should see some special recipients with yellow bags, correct? And with a pictogram with a sign of biological hazard, and separate bags, black bags, for normal wastes, for non-biological waste. Because even if you take blood from healthy patient, you must consider this blood as potential biological hazard for two reasons. First, you never know, is the patient sick or not? Is the patient, maybe the patient is not sick but is infected. The patient couldn't be sick but could be infected. As a result, this blood can represent any risks on the one side. And the second reason is any biological substrate is a perfect, or any biological liquid or matter collected from a patient is a very good culture media. If you will pay attention to the contents of most of culture media, you will observe it is made either of meat, either of blood, either of serum, either of some maybe eggs, maybe so any kind of non-vegetable nutrients. So it is either from animals, either from humans. Why? Because bacteria will prefer this native protein obtained from animals or obtained from humans. As a result, any biological material obtained from human, even if initially it is sterile, it is a very good substrate for normal flora that will multiply and will produce more issues for you in hospital. This is why the topic nosocomial infection is that important. This is why you will hear about nosocomial infections not just on microbiology, not just on epidemiology. You will hear about it almost in any field of medicine. And you will observe that it doesn't matter which kind of hospital you will, in which hospital you will work, or in which country you will work. Is it high-income country or low-income country? Is it cheap hospital or very good dated hospital? It doesn't matter. All of them will have quite similar level of nosocomial infections, because nosocomial infections are resulted from two main factors. First one is hygienic factor. So probably if it is a cheap hospital, if it is a poor hospital from a poor country, there will be issues with sterilization, with disinfection, with asepsis, antisepsis. Will be more issues with that, probably. But they will have less polyresistant strains because this bacteria doesn't have too much contact with disinfectant substances and with antibiotics, just because they don't have some on the one side. On the other side, if you have a lot of and you are using them a lot, some bacteria will survive and will mutate and will produce polyresistant strains. And when you will use the same disinfectant substance or the same antibiotic again, it will be already useless for them. And they will be even more dangerous because as soon as they will get in the human's body, they will produce, first of all, normal flora produces, or conditionally pathogenic flora produces more aggressive forms of infections very often. And second, if the patient is already sick, the patient receives this pathogen and it is also polyresistant to antibiotics, what are you doing? Complicated. It doesn't mean we don't have any solution, but it becomes much more complicated. Now, nosocomial infections can be caused by almost any type of normal flora. Simply because normal flora will not affect you as long as it is present in places it is supposed to be. As long as normal flora is present in places it is supposed to be, it will not produce any issues, any disease. Please. So it will not produce any issues. But in our body we have different places and different cavities and different tissues or liquids that are supposed to be sterile all the time. So if a representative of normal flora or of conditionally pathogenic flora will get in that place that normally is supposed to be sterile, it can produce an infection. For example, if we are talking about Escherichia coli, that is the topic for today. Very good, very good. One of the mostly spreaded examples of nosocomial infection caused by Escherichia coli, correct? It is UTI, and specifically in men or women? Women. Why? Correct. Because women's urethra is shorter, and as a result, and it is closer to the source of Escherichia coli. So, if we have poor personal hygiene, there is a high chance for urinary tract infection in women caused by Escherichia coli. And specifically if we are talking about inpatients. Because if we are talking, for example, about inpatients from ICU, from intensive care units, a lot of them are not able to move. A lot of them are staying in bed. They are not able to make their physiological necessities and their hygiene by themselves. They're using diapers, they're using urinary tract catheters. Here is the perfect condition for urinary tract infection, because that's enough to not change the diaper or catheter on time or in a proper way, in clean conditions. And here you give the opportunity to get urinary tract infection. This is why, in such cases specifically, women will be more vulnerable from this point of view. This is where we can find it normally. But also during the normal hospital life, we are making all around the hospital we are making sanitary swabs from different surfaces to check if disinfection and sterilization is performed properly, if we don't have any contamination, and if we don't have any risk of infection for patients and for medical staff. And if you find Escherichia coli in different places except bathroom, and normally you shouldn't find too much even in bathroom, either in washroom. But if you find it in any other different places of hospital, it is it's risky situation and a very bad indicator, sanitary indicator, because Staphylococcus aureus or any kind of other Staphylococcus, Staphylococcus epidermidis, Streptococcus, and so on. If you will find it on other surfaces, on floor or on table, if you find it, it is not considered as a big issue. It happens. It could be on surfaces. It is important surgical tools to be sterile, to be completely free of any types of microorganisms. But surfaces can have on themselves some normal flora, and it will not be considered as a problem. But if you find on some surfaces Escherichia coli, that's a problem. That's a problem, and you should check who is the source, because sometimes it can be a patient, and sometimes it can be a medical staff. And we are very exposed to be surprised how medical staff can be source of Escherichia coli. Of course, they are also humans, first of all, and second, I'm wondering if you know how many doctors have hygienic issues. Do you know why? A lot of doctors and a lot of medical staff have hygienic issues. For example, right now, who can declare that you are all the time washing your hands after bathroom? Good. Let's suppose I believe you. How do you leave the bathroom, the public bathroom? And pay attention, all of you are using public bathroom, public washroom every day. How do you leave the public washroom? By using a door. Do you touch the door? Of course. Do you know that the majority of previous visitors didn't wash their hands? So even if you washed your hands after visiting a public washroom and you opened with your washed hand the door, not too much sense. Now, those doctors who are, and those people who are aware about this fact, they can open the door with the elbow or maybe with the knee. Hopefully not with with the foot. But anyways, they will find a way to open the door without touching the door, especially in hospital. It is very important because, okay, in public places I don't care too much because as soon as I come home, I wash my hands again and I'm safe, right? But until you come home during the day, you will have few meals.
How many surfaces are touched before
You will have few meals during the day. Who can declare that you wash your hands before every meal? And now I promise you, you are wrong. Even if you think so. Even if you think that you are washing your hands before every meal, I can prove why you are wrong. What do you mean by meal? When you come home or in any other place, you go, you wash your hands, you sit in front of the table, you take a dish and you start eating. You consider this event as a meal. But what about coffee shops? What about all the places you're visiting during your lessons or between lessons?
Especially with placenta.
Yes, especially with placenta. How many times you wash your hands before you eat placenta? In a bus station or in any other place. How many times? Not too much. Yes, but it has a package. And how many times you bite with a package? Just because you're so hungry and it is so delicious and you... Oh, oops. It happens. It happens. And this package have been touched not just by you, but also by seller. And do you know, did that person wash the hands before? Too much contacts, too many contacts, you cannot control. As a result, most of people have these contacts between themselves, and it is not a big problem as long as you are aware about all of these moments and you just wash or disinfect your hands in the mostly important moment. If we are talking about our daily life, it is washing your hands before any meal. And by meal you should understand any food or drink consumption. It doesn't matter, do you have a table in front of you or not? It is meal. If we are talking about our professional life, our professional habits, you should keep in mind, are composed on our daily habits. So if you don't have your daily habit to wash your hands before any critical event, for example, like meal or any other important moment. For me, for example, it is not just a meal, but also contact with my baby. When I come home, I wash my hands not just before meal, but also before, basically after entering the house. And before having contact with baby. Why? He is putting everything in mouth. It is also an important moment. It is also a vulnerable moment. So it is about your daily behavior and about your habits. And if you don't dissolve your daily behavioral habits, you will have issues with professional habits, including washing your hands before and after every contact with patient. That is mandatory in any case. Whenever you receive a patient, it doesn't matter which kind of doctor you are. you will have a contact with patient. In 99.99 cases, you as a doctor will have a direct contact with the patient, starting with handshake, maybe if it is your friend, also not a patient, not just a patient, and finishing with all the procedures you are to perform to your patient. This is why, in the moment your patient is entering, what are you doing? You show your salutation in the moment you wash your hands.
It's a respect for the patient.
And you show the respect, exactly, you show the respect to your patient that you are ready to receive your patient and to accept your patient and to treat your patient with clean hands. And the patient will already subconsciously will have this positive attitude for you, because he will say, that's interesting. I didn't see it too much in my life. So in the moment, did you see such doctors? In the moment the patient is entering, he is washing his hands. It is not just a moment of hygiene. It is also a moment of relation between patient and doctor, because he could simply wash his hands before patient will enter. But it is very important for a patient to see that. It is respect and it is professional attitude. And of course, when the patient will leave, also you wash your hands, this time not in presence of patient. And here you show respect to yourself. It is very important to have this balance between respect to others and respect to yourself as a doctor and as a human. It is very important. So, in the moment patient is entering, you're washing your hands. It is professional and not just sign. And after the patient will leave, you wash your hands again and you are doing your stuff. In this way, you prevented most of intestinal and nosocomial infections. Whenever we are talking about lab investigations of Escherichia coli, we should keep in mind, yes, we should keep in mind that it is part of the intestinal group. So nothing too much different from previous topics we discussed. Lab investigation will include microscopy. As a result, we'll see gram-negative rods, very often situated either in pairs, either in small bunches. If we are talking about bacteriological investigation, it will depend on substrate we take from patient. And again, how we decide what do we take from patient? By symptoms. If we have symptoms of intestinal infection, of course, it is feces or maybe vomiting mass. And also it can be, if we're talking about intestinal infection, it also can be about samples of food the patient consumed, if we have access to these samples. These samples also could contain the pathogens, because look, we have a patient with Escherichiosis. You take selective culture media that helps you to eliminate all the gram-positive bacteria, and it leaves just all the gram-negative bacteria. You detect on selective culture media different colonies of gram-negative bacteria, including colonies of Escherichia. Tell me please, did you diagnose Escherichiosis in this moment? Why?
Oh, no, yes. I changed my mind.
Why did you change your
I
mind?
don't think because we
Think again. Think again, because usually if you know the answer, usually the first answer you give is the mostly correct. Again, you take selective culture media. You take samples of patients' feces. You make cultivation of bacteria. You make coproculture. Selective culture media eliminates all the gram-positive bacteria. Here remains just gram-negative bacteria. And on this selective culture media, you detect Escherichia coli. Here is my question. Did you confirm Escherichiosis? Yes or no?
No, it can be a memorise. No, it's a normal.
Who says?
no.
Not really, because in this moment you just confirmed in the intestinal tract we have normal representative of a intestinal flora, because Escherichia coli will be present in any intestinal tract of any one here in this place, and any human.
So it's not an evidence.
It is not an evidence. It is just a step.
Yes.
So maybe it is a pathogen, but maybe it is not. How do we find it out? It is not enough just to find Escherichia coli. It is also very important to go to another step. Another step is differential culture media. And differential culture media will help you to detect specific species. And just on differential culture media, here we have it. Just on differential culture media, this is example of TSI that normally is pink. Before cultivation it is pink, but if we have here Escherichia coli, it becomes totally yellow because it will ferment all the sugars in this culture media. Also, we can see gas bubbles. That means it produces gas. It is normal. But please keep in mind that Escherichiosis is caused by specific serovariants of Escherichia coli. This is why our diagnosis will be complete when we will perform seroidentification, serological test. And serological test or seroidentification, specifically in this situation we are making seroidentification, not serodiagnosis, because we are looking for unknown antigen by using known antibodies. So if it is serovariant, if this serovariant is the pathogenic one, in seroidentification, that means detection of unknown antigen by using known antibodies. If the reaction will be positive, we confirm diagnosis. If the reaction is negative, we didn't confirm diagnosis. And the bacteriological investigation will mean just the fact this patient also has Escherichia coli in the intestinal tract. That's it. So the crucial or the mostly important part of investigation is serotyping. And other methods of investigation will be just steps on the way to serotyping. Because unless you you isolate the pure culture of the potential pathogen, you cannot make serotyping. You cannot check is it a pathogen or a pathogenic or non-pathogenic bacteria. As a treatment, please keep in mind any kind of intestinal infection is treated firstly with fluid and electrolyte replacement, and just after that with antibiotics. But please don't be in a hurry to apply antidiarrheal drugs, because sometimes we need to give bacteria the time. What happens if you apply antidiarrheal drugs? You stop diarrhea, and toxins that are present in the intestinal tract will not just remain in the intestinal tract, but will be absorbed in the intestine and will get in blood. So, no, toxins will get, you will increase intoxication from this infection. So this is why we start first with rehydration and after that with antibiotical treatment. And after that, because diarrhea is not just a sign of intestinal infection. Diarrhea can be a symptom of intestinal infection, but if we don't have any other symptoms of intestinal infection except diarrhea, that means probably we don't have an intestinal infection anymore, or we didn't have it at all, if we didn't have any other symptoms. We also have such affection that is called dysbacteriosis. Dysbacteriosis is deregulation of normal intestinal flora that could happen either because of previous intestinal infection, either because antibiotical treatment, either because of applying purgative drugs that are eliminating the entire contents of the large intestine. We can have it before some investigations or before some treatments, before some surgeries. We can apply it. So after that, if you will not supply your intestinal tract with normal flora, with prebiotics and probiotics, if you will not supply it, there is a very high risk of dysbacteriosis and diarrhea. Because you don't have normal flora and your intestinal tract is not able to help in digestion. Because normal flora is very important part of digestive system and digestion of each animal and each human. Normal flora is very important. So if we have dysbacteriosis, it also can produce diarrhea. In this case, antidiarrheal drugs will be better to apply than in intestinal infection. This is why in a lot of intestinal infections, antidiarrheal drugs are contraindicated, are not indicated. It is also very important to keep in mind. You better drink more water, you will wash it out, and this is the principle. When you have dehydration, you should drink more than you lost. You should drink a little bit more than you lost. Because you are losing not just through the intestinal tract. You are losing by breathing, you are losing by peeing, you are losing by urination, you are losing by transpiration, you are losing by different ways. And you are not all the time able to appreciate the amount of loss of liquid objectively. This is why you better replace a little bit more you lost in order to recover all the necessities of your body. And after that, we start administration of antibiotics. And if we already don't have any symptoms of intestinal infection but still have diarrhea, in this case we can apply antidiarrheal drugs. And prebiotics and probiotics, that is very important in order to to normalize the normal flora of the intestinal tract. As prevention, nothing new, but I remember one professor on the courses of health promotion have been talking about a radio station from London, and their representatives came here as well, as I remember, to check and to share experience of health promotion on the mass media. And they asked, do you make health promotion on radio? Do you have health promotion on TV? They say yes. And how many times you told about personal hygiene? We told once last year. So you did nothing. If you told once last year, you did nothing. Our society is able to accept some and to process some data and to apply some recommendations if they hear it hundreds times. So you should hear 100 times, 100, 200 times, wash your hands, wash your hands, wash your hands. Probably this is the reason we have that many topics on intestinal infections. We used to have just 2, and now we have 4. In order to remind again and again, the prevention in intestinal infection, personal hygiene in intestinal infection is crucial, is one of the mostly important steps, because it is much easier. Some infections easier to treat, maybe easier than to prevent, but just because it is very hard to change humans' behavior. It is the only reason why it is that complicated to prevent some infections. It is very hard to change humans' behavior, humans' habits, especially bad ones. Did you observe it is very easy to induce a bad habit, and it is very complicated to remove it and to induce the good one. Basically, yes, it is important to remove bad habit. It is possible just to replace it. You never remove it. You can just replace it.
Or reduce it, at least.
You will never reduce it. You must just replace it with another one, with a good one. You need an alternative. If you have a bad habit to do something, to drink something, to smoke, or something like that, you will never eliminate it unless you will replace it with something healthy. For example, buy a bottle of water instead of other things you consume. You buy a bottle of water, and as long as every time you want to do that one, you do this one. And by this way, it will be possible to replace some bad habits. Whenever we are talking about personal hygiene, as well as I told last time, pandemic helped us in this regard, because hundreds and thousands and million times we heard from different sources, wash your hands, wash your hands, wash your hands. Meanwhile, it is useless in respiratory infections, but we reduced intestinal infections. This is why, by saying it is useless, I am not against their not against their recommendations they gave regarding washing the hands, but we should mention it is for another it is for prevention of another type of infections. That is also very important. That's it for today. If you have any questions, please. If not, you can be free.